The definition of the word vaccine is a biological preparation that provides active acquired immunity to a particular disease. They're substances which stimulate antibody production without inducing the actual disease. Basically, it's like a prep for your body's immune system so that by the time a real virus tries to destroy you, your body has enough practice fighting and gaining immunity to it, keeping you safe, healthy, and disease-free. But how are they made? Vaccines can, as scary as it sounds, be made from inactivated or weakened live organisms, secreted products, and recombinant components of the constituents of cell walls. They're made using the same components of natural viruses and bacteria. Actual vaccine production, however, is a lengthy process. The steps are not simple, but they leave us with an effective, safe way to keep from possibly deadly infections. First is the initial production. The wild-type virus must be identified by scientists. Next, once the trial vaccine has been made, its quality is assessed. This includes verification, impurity testing, exclusivity testing, trypsin-dependent play assay testing, embryo lethality testing, and antigen characterization. Then the attenuation is determined, which means that the pathogenicity of the virus is identified. After that, the vaccine is distributed to vaccine manufacturers and other stakeholders. This way, entire populations and communities can be saved. The question now is, why vaccines? Well, the answer is that following a clean water supply, vaccines are the single most effective way to promote individual and public health. The most important qualities of vaccines are eradication, elimination, individual and societal control, mitigation of severity, prevention of related diseases and cancer, protection, health care, and savings. Also, vaccines really do save lives. The American Academy of Pediatrics states that the most childhood vaccines are 90 to 99% effective in preventing disease. According to a partner organization called Shot at Life to the United Nations Foundation, vaccines successfully save 2.5 million children from preventable diseases each year. That's 285 children saved every hour. Also, the CDC estimates that 733,000 American children were saved from death, and 322 million cases of childhood illnesses were prevented within a 20-year span from 1994 to 2014. Some physicians believe that vaccines contain harmful ingredients. However, the ingredients which are deemed harmful are only harmful in large doses, which are never given in vaccines. In fact, levels of aluminum, one of these ingredients, are significantly higher in breast milk than in vaccines. So, the substances that are sometimes called harmful are in higher concentration in our outside world than ever in vaccines. Major medical organizations like the CDC, FDA, IOM, AMA, AAP, UNICEF, HHS, HWO, NFID, and AAFP, among many others, state that the vaccines are indeed safe and are some of the safest medical products available, according to the U.S. Department of Health and Human Services. Some people also argue that vaccines cause an allergic reaction called anaphylaxis, but these are extremely rare. The chief medical correspondent for CNN and practicing neurosurgeon Sanjay Gupta says that you are 100 times more likely to be struck by lightning than to have a serious allergic reaction to the vaccine that prevents you against the measles. Vaccines also prevent the herd from getting infected, save children and their times from their parents and money, prevent future generations from completely eradicating diseases, which has been done to smallpox and polio, and provide economical benefits to society. In the end, advantages to vaccines in both human and animal health significantly pass the disadvantages. So, vaccines are not selfish medical practices. While they can save individual people, they can also stop entire community-wide epidemics or even worldwide epidemics, leading to the world into a safer and healthier future.